everyone. My name is Dr. Kenneth Ayers, and I'm happy to be here with you all today with an esteemed panel of guests who are going to help me talk to you about mental health in communities of color. Currently, right now, I am a postdoc fellow at Rutgers University in sport and clinical psychology, and I'm going to have the panel themselves introduce their names, where they're from, a little bit about themselves so we can get acclimated to who they are before we jump into a few questions to give you some great information that we're looking forward to doing tonight. So I'll go have you started.
All right, thank you. So my name is Dr. Ayatunde Ayabello. I'm a child and adolescent psychiatrist and assistant professor at the Yale School of Medicine, the Yale Child Study Center. And in addition to that, I am also an artist. I am a Black man, I am a father, and I am extremely excited to be part of this panel and sharing some of my knowledge and experience alongside my colleagues here. So I'll pass it on.
Hello, my name is Dr. Carlita Elias, and I'm a clinical psychologist, and I am also an assistant professor of psychology, where I see clients across the age span, but my primary focus and interest is in perinatal mental health, which is covering from pregnancy through postpartum, the early stages of parenting, and also early relational health, so focusing on infants and young children and the relationships that they have with their caregivers.
Good evening, everybody. My name is Dr. Edna Rodriguez. I'm also a clinical psychologist, and currently I serve as the regional director of behavioral health for Trinity Health of New England. In my role, I oversee the access to care to inpatient psychiatry programs, emergency department, addiction services. And in my role, I make sure that we provide services in a high quality standards, and that we also provide access to care to those who are non-English speaker. And we try to, I consider myself a translator of behavioral health to the medical field. My role, I do a lot of advocacy for anti-stigma and trauma-informed care.
Good evening, everyone. So my name is Carolina Rivera Parrott. I am a licensed clinical social worker, bilingual, bicultural social worker. I'm actually from Puerto Rico, and I practice at the Yale Child Study Center School of Medicine. And I'm also an assistant clinical professor there, as well as the director of social work training. So I get the opportunity to also support and help grow the next generation of social workers, and I love that work. I'm also a mom of 2 little ones and a wife, and yeah, that's a little bit about me. Happy to be here.
All right, thank you. And it's, again, great to be here with you all. So I'm going to go ahead and jump into our first question for you, and just feel free to jump in if there's something that really catches your ear. So the first question is, so each of you comes from a different path of mental health, a different discipline, that being psychology, psychiatry, social work. If you can, please briefly describe your role supporting mental health and how your work interacts with the other professions that are here.
Since I have the microphone, I'll go ahead and start. So yes, as a clinical psychologist, my primary role is providing clinical services to the population, and switch. Okay.
Is primarily providing clinical services to the population, and that means doing therapy, doing assessments, doing consultation. A part of the work that I do is also supporting people who are in the mental health and early childhood workforce, supporting them through supervision, reflective supervision that supports them, helps them to deal with the emotional impact of the work that we do. And then also my time is split between that and training. So teaching and teaching about the theories and teaching about students about how to do therapy and also about how to take care of themselves and their own well-being as they're learning to, how to be in this profession.
And so, as a social worker, part of the lens that I practice from is really from a culturally informed lens. And so, part of my clinical practice that I do and the way that it intersects with other professions is that in social work, we really practice from the lens of the ecological perspective, so the person and the environment. And we look at everything that psychologists look at as well in terms of like the interpsychic and what's going on internally, but also how that intersects with the environment and the person and the environment that they're in. And so we look at a broader picture, and also within the work that I do currently, I get to collaborate often with psychiatrists, psychologists, and other disciplines in the helping profession, which is something that I find really gratifying because I get to learn from other professions, and it also supports the clinical work for the children and families as well, to have some of that background and collaboration.
As a leader in a large hospital system, my role has to do a lot with overseeing programs and the not so clinical and fun stuff like staffing and making sure that we have enough people to take care of patients. So I do some of that, but the part of my role that I think really matters, my degree and the experience I have really matters, is when we are talking about building policy and building clinical programming. And I get called to cases when there is a problem. So usually I intervene in a system or where there is there's a bump in the road, and I can help other professionals such as doctors, psychiatrists, nurses, counselors to solve those problems for the better of the patient. I collaborate with people like you because people that I see in the hospital are often really sick. So my role is to sort of like stabilize them and help them see that there is help out there in other systems and in other levels of care, that they can actually get the work done to heal from their conditions. So people like me need the community, the academic community, to really send our patients out and hopefully see less of them coming into us at some point, right? So that's pretty much what I do.
All right, I think I am next. So, yeah, I think to sort of follow up on that, as a psychiatrist, I have worked in different levels of care. So, I've worked on the inpatient level of care, which is sort of the higher acuity level of care. And, I've also worked in the outpatient, level of care, which can include things like residential, treatment, partial hospitalization, and private practice. But I think, to tie everything together, mental health and behavioral health in general is a field that is very collaborative. It's really crucial to get perspectives from other professionals, other points of view, and not seeing the child or the patient as just the silo, but seeing them as being part of a system. So it's crucial to really collaborate with other professionals in the healthcare system. So yeah.
I appreciate hearing you all talk about the aspect of mental health that you work in, and the overlap that's there, whether it's clinical work, whether it's training, administrative, inpatient, medicine care. And I know one of the things that all of us come up against when we are working, and probably more so even towards people from communities of color, are some of the myths that exist out there about mental health, healthcare in general. And so moving into our next question, I'm wondering, what are some of the myths that you frequently encounter about therapy, about medication, and how do you help your clients or your patients kind of move past that and start to feel more comfortable about seeking and engaging in care?
Okay, I can get started. Yeah, that's a great question. I think one of the maybe biggest myths is maybe that therapy and seeking help is not effective, or will not be helpful, and maybe there are beliefs that there are other ways that you can get help, whether it's talking to a friend or talking to a family member, or going to your religious institution, the church. So I think there's a belief that the maybe mental health system is not effective, or can take advantage of the public, and I do believe that's one of the biggest misconceptions. And we try to explain, and we try to share what the mental health system really does, and how it's really important to build relationships with clients, and build trust with clients, because I will say there are situations and there are stories that you hear and you realize that, okay, like that shouldn't have happened, or that was a negative experience. But those are, I think, far and few. And we really need to sort of improve that perspective, and let them know that the mental health system is here to support them and to care for them. So I think that's one misconception.
I think a misconception that I come across a lot, and again, because I work in an acute setting, it's that we like people are going to be condemned to always be visiting this highest level of care. People are scared that now they're dependent on medications, or that basically their lives are going to be taken over by a diagnosis. Um, and I want to say to anybody who's listening to this that that's inaccurate. That having a mental health diagnosis, that having a struggle at a point that requires you to be in a place like a hospital, it's like getting appendicitis and requiring a surgery. You get your appendices out and you're better and you're fixed, and you go to your gastroenterologist after, and you go to your PCP, and you continue your health wellness journey. It can be the same. There are moments that people need higher levels of care, and it's adequate to come and seek those in a hospital. And most times, if people pay attention to their symptoms early enough, they will never end up in a place like a hospital. But if somebody does end up there, that doesn't mean that they're condemned to always live there, that now their lives are ruined, or they're another one that I hear is like, I'm not going to find a job because I want to go to X or Y job, and people are not going to want me because I was here. Like, it's confidential. You can have your privacy. So I think that in a higher level of care, people do feel defeated, like their lives are over as they knew it, because they visit that level of care. And it can be a situation where you go get treatment and then find a path for you to do it in the community and keep moving. But many times it's necessary and actually life-saving to be in the hospital.
I think just some of what my colleagues have already said, I agree with. And I think just to add to that too, one of the things that I've seen in the communities that I've served as well is the therapy is not created for me. That therapy was not like meant for me. And so, and to some degree that is true, because therapy for some folks, it hasn't felt relatable, like they haven't felt represented, right? For especially the communities that I serve, that are primarily Latinos, Black and Brown community. And so what does that mean for them? It's that, well, yeah, I'm not being seen. Like my experiences are not being reflected here, right? And so I think oftentimes I can understand that, and I also can see that there could be a benefit, right? And I think part of that is the rapport building, and part of that is a representation within our field that I think is important as well. But as well as acknowledging that, yeah, those things exist, and I think the other piece that I think is also important, specifically. I can speak to my own community, like being a Latina, that like therapy is for like changas, like it's weak to get support. And so that's also a real theme, right? That like if I go and get therapy, that says something about like me not being able to handle this really hard thing in my life. And what does that look like for me? And what is the stigma associated with that? And that is a cultural kind of belief, right? So I just wanted to highlight that as well.
Yeah, and I would add on to that that's something that I've encountered quite a bit in my practice as well. And primarily, I serve Black and Brown women and birthing parents and their children. And some of the things that I've heard very similar things about, feeling that therapy means that I'm weak or that it won't work. Um, a lot of times people have had experiences where maybe they were in a therapy relationship that wasn't a good match. And so where they didn't feel that they were seen or heard, or they were in a system that if you missed an appointment, then you were kicked out and, could no longer get the services. I think another um, thing that I encounter as well is feeling that therapy is going to be adversarial towards faith and in faith communities. And I like to reassure the clients that I work with that, you can talk about your faith as well, and we can figure out how to integrate that into helping you to be well. And, how do we make sure that you're in a healthy faith community, and how can you determine those things as well? So I like to tell people that you can have Jesus and a therapist.
That's so true.
Amen to that. Amen to that.
Yeah.
So I appreciate hearing everything you all shared, from representation, and describing some of the myths that continue to be reinforced by maybe some bad experiences that may not be as bad as the myths. But as we kind of go along that line and consider the mistrust that some of those myths serve to maintain, what are some ways as providers that we can, and the providers out there, that we can start to help rebuild trust in our patients and our clients for the care that we provide, for the healthcare system in general, to make them more comfortable coming in?
I've had this experience, and especially it happened a lot during the pandemic and doing telehealth, when a new client will come onto the screen and see my face and see that I'm a Black woman, that just the relief of like, oh, right? Like that sense. So I think increasing representation in the field and also supporting our students and new clinicians in being able to be well and to do the work, and and wellness. And I also think that another important thing is really, also what happened during the pandemic, and the what we might call the racial reckoning, and a lot of people becoming aware, for some people for the first time, about the impact of systemic racism. And a lot of pledges were made about, I'm going to learn, I'm going to do better, I'm going to do my own inner work to figure out where my biases are. And I think really making sure that we hold people to that and support people in that, and making sure that that's a part of our training and supervision, like making sure it's spaces where we can bring whatever identities that we have, and to understand, how who we are is going to impact the clients that we're working with, and how do we make sure that we're reducing the harm that can come when we have unchecked implicit biases.
I agree. I think what you're saying is so salient, and I agree 100% that I think part of it, right, is like also remaining that you were talking about just being critically conscious of like your own biases. And because, just because I'm a Latina doesn't mean that I don't have biases, right? Like that's also really important to be reflective on, like, how am I showing up with this person in front of me, and what is that saying about who I am, and in the ways in which I might be showing up, right? And so I think it's also really important to do that work. And the other thing I think about too is like, and this is the lens I practice from, is like just remaining curious about the families that we're seeing in front of us, right? Remaining curious about who they are, where they came from, what their culture is. Like, I think historically we've we've been taught historically to practice from a lens, and I know this is true in social work, to practice from a lens of like cultural competence, and that's really, that's not the way, right? Like, it really should be that we practice from like really cultural humility, and like, what does it mean to be culturally responsive? What does that really mean? Like, it really means sitting there and knowing that you don't know everything and that I get to sit here and learn from your experiences. And like, not that you have to educate me either, because that shouldn't be the case. But that like I can tailor whatever work I'm doing, especially now, and when we're looking at evidence-based practices, when we're looking at data informed clinical driven interventions, I think is even more important to be thinking about, how does this work connect with the family in front of me, and how can I and I do a lot of like the adapting of these models, adapting this, because I know that the research hasn't been done in these interventions with the families and the communities that I'm serving. I know that. And so how do I then work and adapt these models to really serve the communities that I'm serving in the way that makes sense for them, while also holding in mind their culture, their values, their belief systems, whether that's their faith, their traditions, their language is so important. Being able to make space for that. That if I don't speak the language, like having a translator, having someone that can do that work with me, I think is super important too. Those are some pieces that kind of come to mind.
Yeah, I think I agree very much with curiosity, like you mentioned. That is one way that I sort of build, the trust, with a client or with a patient, just being genuinely, curious about their experiences, and, being very thoughtful in how, I approach this person. There's a saying that, a person doesn't really care how much you know until they know how much you care. And I think that's so important. And I think also not, coming into the room with an agenda or, preconceived notion, or like, like we talked about, a bias, and, really getting to know the person first, because I think once that trust, is established, it's easier to move on to talking about more challenging things or more complicated things once that baseline of trust has been established. So yes, curiosity is crucial.
In my role, working at the hospital, I think that continue to work on people taking accountability, that we that are working in a hospital and a system, we didn't create this mistrust, but we either perpetrate it or are responsible to change it. And that's a hard pill to swallow, right? For a lot of people, because we're busy, we have constraints, right? Um, and I think that one way that I have found that it's a good way to ease that is the presence of peers, people with lived experience in mental health and addiction services and seeking services in the hospital, being part of policy building. So when you're creating a new policy or you are thinking about changing something, don't do it from a place of a provider. Ask the people that you serve, ask the communities, ask the community people that represent the community, and bring that to the table. Long are gone the times and the days that the hospitals were there in a bubble. We need to bring the community in, and that's our responsibility. And the more we do that, we build trust with the community. Because when our patients and our people served see peers in the hospital and they see them as respected and valued and having an opinion at the table, they say, wait a minute, I am valued too. And that translates. And I think that creating opportunities for that might need some out of the box thinking, but it's really necessary because we cannot we cannot keep coming from an expert view of things and problems. We need to come from a view of the people receiving the services.
Yes, thank you all. I think a theme that I kind of picked up on throughout all of that is presence. So being present as clinicians, being curious about the presence of the people that we're working with, and being representative in any administrative and policy change that's happening, and acknowledging what needs to be done. As we continue to think along those lines about some of the different social and structural barriers to accessing mental health care, what are some of the ways that can be helpful for clinicians to address some of those barriers so that patients, so that clients have better access or know how to access the care that they need?
I want to say we continue to struggle with barriers like transportation, access to technology, access to appropriate healthcare insurance coverage. Um, do not assume that people have everything they need to come to therapy or to get a telepsychiatry or that they can pay for a therapy that they need because they had trauma and you're a great trauma provider, but there might not be the funds to do that. There is a sector of the population, and this is more specific to people who are publicly insured, that are really struggling to access of care, and they might get to see somebody, but not might get to see you. You're right. Or I might get to see somebody with the expertise that looks like them. They see often people who are in initial stages of training that don't have specialized training. So those barriers continue to be very much a reality for a lot of the people that we serve, and continue to navigate that at the public policy level and community level. It's still important.
Yeah, I agree. And I think thinking about even just in terms of the transportation piece is such a huge barrier, especially depending on where you live, right? Like I live in a city where bus is not easily accessible. Like you have to take a transfer to get to a specific area. And so the expectation that you need to be at your appointment within 15 minutes from the time, or 15 minutes ahead of time, when you have other things on your plate, when there's other things going on, I think that's a little bit tough to meet. I think even from a cultural lens of understanding the concept of time, right? Like what is the concept of time in here is very different than the concept of time like for many communities. And so having that judgment that this person should be able to make this, and they should be able to make this work because that's our westernized view of what it should look like, I think that sometimes can also be a barrier.
And I think I have kind of a little bit of a specific question or thought to Ms. Carlita here about maybe if you could speak to some of the structural barriers to training, to people wanting to get into the field to be clinicians, and how we can maybe overcome them, or how to better access training to provide the care so that we have representation.
Oh, that's a really great question, right? And so thinking about how do we mentor more students to be able to be prepared to join the field, and also how do we help to make sure that those who are making those admissions decisions are also have done their work and checked their implicit biases, and so that and during the selection process, it's not always like, oh, well, this person seems like me, I think they would fit, really helping people to make sure that they're thinking about representation in the field as well. I think that mentorship from high school all the way through, to help nurture individuals from underrepresented communities, whatever they may be, to be able to understand the field and to kind of know what the different career paths are, and also just really, I think I would encourage other professionals to make sure that you're taking someone under your wing in some way. Like in Connecticut, we have a task force that's a part of the Connecticut Psychological Association that provides mentorship for ethnic diversity within the field. And so we'll match people with mentors when they're undergrads, and to help nurture them so that they can understand the whole graduate school process, and helping them prepare for interviews, helping them prepare for internship interviews and that sort of thing. So I think focusing on that would really help to break down some of those barriers for training.
Absolutely. I appreciate hearing that. Definitely agree about mentorship at all the levels, whether you are a college student to mentor high school students, or a graduate student to mentor college students. I think that it's really important to kind of continue to allow for more to come into the field. Did you happen to have any thoughts about any of the structural social barriers that you might encounter or have seen, maybe even particularly in the inpatient side, and ways that patients and clients and their families can work to kind of overcome those as they access care?
Right. I think one point that I'd like to make before that, because, as we were talking about, training, I started to think about sort of the process to, becoming a psychiatrist, and, just how expensive, that process is. There are, multiple, exams and, multiple tests that you have to take that cost thousands of dollars. So I started to think about like policy as well, and how, making changes on that level is really going to be helpful. We've seen, sort of this gradual shift of, medical schools, starting to realize like the, tremendous like amounts of debt that, just the whole educational process, confers on students. And, I think there are a couple of big medical schools that have made tuition free for families that earn a certain income. And I think that's a step, forward, but, there's still, so many steps to go. And I think that's a crucial barrier that affects, access to, these training programs, right? So, yeah. And then in regards to the inpatient, aspect, I think, having, knowledge, and having, someone, so for a lot of times in the inpatient units, there are patient advocates that, work with, patients, and will sometimes like explain a lot of things. I think as providers, sometimes we're guilty of like using a lot of like medical, like, terminology that, the patients might not understand. And, things like this start in the emergency room where, we might explain that, okay, like you might come in for a certain amount of days, but then, they get into, the hospital, and that might change for, different reasons. And I think that sort of starts this, mistrust, process. But I think, having a, patient advocate and, just getting the knowledge, is going to be crucial, and, can be very helpful.
Thank you for that. I think that is a very good point about getting the knowledge, whether it's from a patient advocate or simply just asking questions and asking your provider to take time to further explain it, or someone who is present can be really helpful in overcoming that in those particular situations. As we kind of shift a little further into talking about culture, culture being whether it's race, ethnicity, religion, family upbringing. I'm wondering, what are some of your opinions about some of the views that you encounter regarding culture coming into mental health, and how you're able to maybe address some of the important factors about culture that your patients and clients come in with?
I felt like, so kind of going back to kind of thinking about what are the already preconceived notions that our families are coming in with, or the individuals are coming in with, right, about the systems and who we are and the systems that we represent, I think is also a factor as well. And oftentimes, what I have noticed just culturally, like just taking into consideration, like what are the things that are important to them in their treatment is really important as well. Many times, a lot of the families that I serve, when they come to see me, this is their first time they're seeking therapy, for many times. And so taking that into consideration too, right? That like, what is that? They're coming very vulnerably, like, to this space. And we talked about being the expert, right? Like, we standing in that space of being the expert is not the most helpful, many times. And I have had families, because they've come from different countries, they will call me like doctor, because that's the reverence, right? Like, for them. And like, many times they see you as for me specifically, right, Latina, Spanish speaking, as like someone that is, part of their community now, right? And so they build this trust with you, like, many times immediately, at least my experience, right? And I think is being really aware that, like, of what does that mean, like the importance and the magnitude of that, and the role that you play in their care is not taking that lightly. I think is really important. And I also think sometimes where I start too is getting to know from them, like, what does treatment mean to you? Like, what are the ways in the areas of your life that you seek strength from? Like, what are the things that you pull strength from? Because maybe it is for you spirituality, maybe it is religion. For a lot of my families that I've served, like, religion is a big factor, spirituality is a big factor. And so if I dismiss that, if I don't honor that as part of their of who they are, then I'm dismissing a really big important piece of treatment, and effectiveness of what treatment could look like. And I think sometimes we come in with the assumptions that we have the manual, we know what we're going to do because we see the symptoms, we see the, on the paper, right? But I think it takes so much more effort to sit there and really say, this is what I'm hearing from you, and tell me more about, before you walk through this door, like, what are the things that have helped? What are the things that you draw for, and how do we strengthen those things, while also adding some additional pieces that might be helpful to you, may not. And the ones that are not, we're not going to we won't go there. And the ones that are, right, like, we're going to talk about how that fits for you, right, in your life. And I think that's important, especially being Latina, being Puerto Rican, knowing that therapy wasn't accessible. Like, I know in my lived experience, for many reasons that we just talked about, right? And so keeping that in mind too, that, like, this is the person who has been able to get through life without therapy. And so, like, how do I support them now in this stage of their life, with the tools that are potentially available to them, with also holding in mind what they are coming in with, the strengths that they're coming in with, and the tools that they already have that they're coming in with as well, I think is important.
That was a wonderful response. I'm going to try to add something valuable to it. Um, I think that to add culture to me means really look at support systems and what am I missing, and again asking the person that I have in front of me, and learning more about what they value. I see a lot of culture play out in the concept of boundaries and in the concept of familial responsibilities, and it's really easy for somebody to say you just need to cut that person off, or you just need to create a boundary. Yeah, it's not like that. It doesn't work like that for some families, and actually creating those boundaries can be sort of a loss. So we need to acknowledge that we need to take responsibility, that our recommendations need to be based on those cultures. Also want to say that different sort of sectors of our clinical populations have also subcultures. I see it a lot on people who are experience homelessness, or people who are experiencing substance use disorders that are extremely acute. There are cultures of different ways to earn money, the different ways to receive treatment or to approach the system, that sometimes we judge as like, oh, this person is just using the system and so forth. And we tend to discount them and not taking accountability that there is a function to that behavior in that cultural sector of their of their clinical presentation, you might say. So it's really a journey of always knowing that you don't know everything, and that you are open to receive information for the most expert, who is the person that you have in front of you, that they're experts on themselves and you're just a tool to help them figure out things. So keeping that in mind.
I will also add to that that I think as professionals, one of the things that we can do is to really critically examine our theories and um, the treatment models that come up, to really to not be afraid to really interrogate how what biases are implicit in those theories, and to, when clients show that to us, to acknowledge it and say, you know what, you're right, maybe we don't have to do that part of, this treatment in order for you to get better. Like, maybe you don't have to do homework assignments, outside of therapy sessions. And, to really to just not be afraid to ask those hard questions.
And not color resistant.
Right.
Or
Right.
non-compliant. Or non-compliant.
Right.
Yeah.
All right. So I appreciate hearing all of that, and kind of where we ended was a bit of responsiveness to, as we are providing that treatment, being culturally responsive to what the client is working in with, what works for them and within their culture, which is very, very, very important. And I'm wondering now, kind of as maybe an aside, or really to get a better understanding of not just the care that we provide, and not to just talk about the patients and the clients, wanting to know a little bit more about you all and what you do for your own wellness. And so what does it take for you to be able to show up in the place and provide the care that you do? How do you maintain your own wellness, and your own mental health wellness?
I think this is such a great question, because, I think people who work in this field have a, specific responsibility to, make sure that they are nurturing themselves as well, and, putting themselves in a position to be able to help others. So I think it's so crucial. I personally, try to take a, rather holistic, approach to my wellness. I recently developed a tool called the Wellness Pizza, and it's a very fun and interactive tool that helps me on my wellness journey. And like the name implies, it looks like a pizza, but the slices of the pizza are all things that help me with my wellness and, help me improve, my well-being. And, it includes things like, making sure I'm moving my body, often. It makes, reminds me of things, mindful things like journaling and meditation. These are things that I didn't necessarily grow up learning about. I grew up in Nigeria, and in Nigeria no one journals. It's not a thing, right? So I'm growing up and understanding that, oh, wait a minute, this is a way to help me understand my thoughts. And, when I feel overwhelmed, this is, one outlet for me. That was really helpful. So I use this tool as a way to really help me improve my wellness. And yeah, that's one way that I do it. Okay, I'll pass it on.
All right. Well, my wellness pizza would include things like rest, and really making sure that I am appropriately getting rest, and connection with others. So not being in isolation, and also really connecting with nature. finding that that provides an opportunity for just kind of stillness. Like I find that I like being near a large body of water and to just sit quietly for a little while. But I think it's important to be really intentional about doing things that make you feel good.
For me, journaling actually is it's a good one and a very powerful one. I get to process a lot of my moral injury, how I feel sometimes at work. You cannot be a superwoman, a superhero all the time, and that weighs on you, especially when you carry a lot of responsibility. And being forgiven to myself and allowing myself to move through to improvements and periods that feel like failure just as a learning opportunity. Journaling is really powerful for that. And I nurture my faith as a source of connection and as a source of purpose. One thing that I notice when I'm feeling like I don't know why I'm doing this, like where am I going? If I'm asking those questions, I'm already too late for any self care. I'm already need a day off. I need a lot more than journaling. So you know, kind of like analyzing where I am and how I get there every single time I get there, so I prevent myself from going all the way to burnout. So it's pretty much a journey. I also find and value a lot of my family time with my partner and my children. Sometimes it's just a walk or just dinner where we all get to sit down and just knowing that that's what I'm working for.
For me, my faith and my relationship with God is a big piece of how I stay grounded, and I think it is like it's what drives a lot of like my ability to do this work too. And I think for the other things like as well is for me, movement is a big piece of always who I've always been. As a kid, I've always been dancing. Like I think I was dancing before I was walking, and so I like that's is huge. Music has been a huge piece of my life, and it's been part of something that I'm doing now a lot too. And so my community that I currently I have a gym community, it's an all women's gym, and so I get to teach some dancing while we're also movement, like while we're working out, and so I get to do that there, and I get to do that with my clients too. So when my clients identify like this is the space of something that I enjoy doing, I bring that into the work as well, because I think for some of us that is salient, that is something that is true to who we are, and it's been for me. Dancing has been a big important piece. So whether that's salsa, merengue, bachata, I'm moving, and so I love it, and that's definitely a big piece of my self care.
I appreciate hearing all of that. We pour a lot into our clients and to our patients, and it's important that we make sure that we are refilling our cup, as I often say, or eating enough pizza with whether it is journaling, movement, all the different things that are important to us, and staying connected to our loved ones. As we are thinking about this idea of mental health conversations, just like the one that we're having, and how it has evolved, if maybe one or two of you can kind of reflect on the evolution that you may have seen throughout your career of mental health, and maybe even describe something else that you feel is still needed. One person speak to that for us.
I think I can say something about this. I think over the past decade or so, there has been and I think increased recognition of mental health and the role and the impact that it plays on us as individuals, communities. I'm a big athlete, and I think recently there's been a few athletes who have really advocated for mental health. Simone Biles and a few other basketball players, and I think that is starting to grow. Also the age of like just technology and like people having more platforms to be able to like share their experiences has been helpful. But I do believe there's more progress to be made, and that we can continue to build on these initial building blocks that we have.
Yeah, I think that's important, that platform that people have, whether they are athletes or celebrities, to talk about either their own experience or just promoting mental health can be very impactful. And like you said, lots more conversations to have. As we wrap up now, we'll kind of have our final question here. So whoever wants to speak to it, but for anyone listening tonight who may be a bit scared or skeptical, or unsure of where to start when it comes to seeking mental health care, what are some of the things, or maybe the first step to take, that you would recommend for them to do to kind of get that access and get the ball rolling on accessing the care that they need, or maybe the care for someone that they love?
I think one thing I'll say is that many times, like, calling and making an appointment to see a therapist may not be the first thing that you do, and that's okay. Like, that really is okay. And I think many times in, like, church communities, I talk about this too, where, like, what you said, Carlita, like, it's okay to have and be grounded in your faith, and also seek out therapy, but that may not be the first place that you start. And so thinking about, like, what are the things that you need, and reflect on how is it that who am I, and how do I align who I am with maybe something that is, like, gonna support me, whether that is music, whether that is a gym community. Like, that's the case for me, right? Like, and I also have a therapist, and I have, right, trust me, I have no problem with that. And so you could have both. And so I think just being, like, really reflective on, like, how maybe therapy is the case, and that's great too. And sometimes it's hard to find a therapist. It's hard to find a therapist that you can feel seen by, that you feel that's very representative of who you are and your culture, and where you're from. And so what are some other ways that you think about, what are my values? What are the things that support me, and who I am, and what I need in this moment? What is my community? Because many times that's where we started. Like, it started with the village, right? Like, we have our village, and how do I draw strength from there too, and not do it alone? Because I think that's the important piece. Is, like, we don't have to do it alone, and I believe very strongly in that. And community, I believe in power in numbers, and being together, and really getting that support from each other. So.
Thank you so much for that response. I think that it's really important what you said about having the connection to other people, and being aware of your own values and what it means to work towards them, and what resources are others that are in your community already that can help you work towards those values, even if access to mental health care isn't readily available. I've enjoyed listening and talking with you all, and I'm sure everyone out there has enjoyed listening to all the recommendations and thoughts that you have shared, and continue to do the great work that you do. And anyone out there who is in need of care, seeking care, start with your community, start by asking the question, and someone will help you. So thank you.
Thank you.
Trinity Health in New England is a team of diverse professionals, varied experience, rich in skills, and full of heart and compassion.
We have, through our history, been the recipient of many awards and quality accolades, and that holds true even to today. But without our colleagues, those individuals who are walking through our doors day after day after day, shift after shift after shift, delivering care, no matter what the circumstances, to our community, they're the ones that allow us to be successful. They're the ones that allow us to provide that quality, compassionate care.
Our colleagues have shown resilience, strength, unparalleled ingenuity, and great care excellence time and time again.
Every day I see our colleagues shoulder to shoulder, working hard, having the rigor and the tenacity to constantly improve the work that we're doing and the care that we're providing.
Each and every colleague is a mother, a father, a son, a daughter, a cousin, a brother, a sister, a friend, who bring their own personal lives and experiences with them to work every day. And that's what really creates our culture and defines who we are as an organization. We have battled each and every day, delivering compassion and a healing presence to our community.
We have a mission, and we live our mission every single day.
Our dedication to our communities, our abilities to persevere, be creative, and always deliver what we do with excellence. I feel grateful and proud every day to work for Trinity Health in New England.
We are
Trusted providers,
Leaders,
healers,
advocates,
hope infusers.
friends.
we are
Trinity Health of New England Mobile Healthcare.
Mercy Medical Center and affiliates,
Mount Sinai Rehabilitation Hospital,
Johnson Memorial Hospital,
St. Francis Hospital,
St. Mary's Hospital.
Trinity Health of New England Medical Group.
We are Trinity Health of New England.
Lauren Mentasti. I'm a general dentist in Avon, Connecticut. My dear friend and patient, Pat, invited me on a journey with him, and he's going to share some details with you now.
Hi, I'm CW5 retired, Pat Nelligan. I was the 8th Command Chief Warrant Officer of the Army Reserve, and after serving 42 years of continuous service, I retired last year. The day I retired, I declared war on military and veteran suicide, specifically because of what I saw through 42 years of service and programs that weren't working. The Elpis Alliance is dedicated to going after this terrible, terrible tragedy, and with the team of specialists that we have, we are determined to make a difference.
It's my privilege to work with Dr. James O'Brien. We believe sleep is the key to both physical and mental health. We're conducting a study with veterans who are struggling. Because there's no universal prescription for healing, we're customizing our interventions. The first step is an assessment of the airway to address underlying issues like sleep apnea. Without oxygen to the brain during sleep, nothing else matters. Disrupted sleep is an invisible crisis, fueling suicidal thoughts within the most vulnerable. Participants begin sleeping better and become better versions of themselves. This army of sleep savants will pay it forward, helping others who are barely hanging on. We're collecting data, we're listening and learning. The success of this program translates to all populations at risk for suicide. We are proving that fixing sleep saves lives.
Chronic sleep deprivation is a byproduct of military service, and upon discharge, there's been no coping mechanism to deal with it until now.
To learn more and support our efforts, visit elpisalliance.org.
Hello, my name is Jennifer Bedele, and I'm a clinical psychology doctoral candidate at the University of Hartford. And I'm here to invite you or anyone that you may know to participate in my dissertation research study. The purpose of this study is to investigate how a person's sense of their racial identity impacts the connection between stress from racism and mental health outcomes such as depression, anxiety, and PTSD, specifically within Black Americans and Black immigrants. Now, criteria to participate includes identifying as a Black American or a Black immigrant. This includes first, second, and third generation. You have to be 18 years of age or older and currently reside in the Northeast for at least 6 months. So all the way from Maine to Virginia. Now, participation is entirely voluntary. It does include completing an online anonymous survey that takes about 30 to 40 minutes, and for some folks, even less than that. However, there is no obligation to complete the study. You can start and withdraw at any time without any penalty. However, individuals that do complete the entire survey and meet full criteria are compensated with a $20 Amazon gift card that is sent to them electronically. And so, if you do meet criteria, I invite you to utilize the link or scan the QR code that you see on the screen. Or if you don't meet criteria, but you do know somebody that does, please feel free to send this to them to help them contribute to this important research study. Thank you all so much in advance for your participation.
A began with having much more paranoia than any child should have.
It's like you can't come up for air. It's almost as if all your hopes and dreams just disappear.
He would say, Dad, I'm going to tell you, it's like I'm sitting on the steps watching myself do something that I wish I wouldn't do, but I can't stop myself.
Many people think is that this is a moral issue, not a medical one.
So whenever you go to a psychologist, you are crazy. Because of that pressure, I felt kind of like, I shouldn't do that because I don't have a problem.
Is this gonna be the new Michaela? Is that old Michaela gone? Are we ever gonna see her happy again? Is she ever gonna smile again?
He had started to feel really badly. He called a psychiatrist, like, we can see you in January. Like, we can't wait until January. So literally he was like white knuckling it.
I was right here looking at that house and realizing that he would never be back here again.
I would tell people that she died of cancer because that was respectable.
If you had a friend or a loved one that could not see the light at the end of the tunnel, would you go sit with them in the dark?
There's always a piece of me that's hopeful, always.
She said, Mom, I feel better.
What reaches people the most is when they find out that someone in their daily life has gone through something terrible and they're still the same person that they had grown to love. That's how the fear stops.